Hello everyone, welcome to my free webinar, Using Acupuncture Therapy, the master key for soft tissue pain treatment. I'm Dr. Huang. I would like to introduce myself of my education background. From 1983 to 1988, I got my bachelor degrees of TCM in Nanjing University of Traditional Chinese Medicine. From 1988 to 1999, I worked at General Internal Medicine Residency of Jiangsu Provincial Hospital of Traditional Chinese Medicine. Between 1991 to 1994, I got my master degrees of Chinese Western Integrative Medicine. From 1994 to 1997, I got my medicine doctor's degree in Peking Union Medical College and the Chinese Academy of Medical Science. From 1997 to 1998, I'm a research associate in China-Japan Friendship Clinical Research Institute, Beijing. From 1998 to 2005, I was postdoctoral fellow in the University of Manitoba, Canada. From 2005 to present, I'm working at AAHC Ankang Acupuncture Healing Center, Winnipeg, Manitoba, and Canada. I also published 2 books in Chinese version. One is collection of single Chinese herb clinic application. Is this one? Another one is a collection of single acupuncture points clinic application. Is this one? How did I treat pain patients before? Just as most of yours, I always spend 30 to 40 minutes use acupuncture needles in the pain areas of the body. I may choose at the arch points or choose some points along the meridians. After 30 minutes, and I may apply the cupping on the pain areas 10 minutes to 20 minutes. After cupping, I may apply another 5 minutes massage to the patient. And then I give patients some herb medicines. That's all that my procedure for the pain treatment. It may take around maybe 1 hour to treat one patient. How about the treatment result? Same as yours. Sometimes works, sometimes doesn't work. How do I treat pain patients right now?
Treatment, my swelling of my muscles, I felt nice and calm. There was no knots anymore, and no burning at all after the treatment.
So that you're very happy with that?
I'm really happy. Yeah.
Oh, it's a little better.
It's better?
Yes, sir.
Yeah?
Okay.
You see different right away?
Yes, I did.
Get up.
I'm trying.
Okay. Okay. On the side.
And this, on this side, on that, when I do that, this is not as bad.
It's all here, right?
It's all right here.
Okay, gotcha. On here?
It's okay.
Okay.
Oh.
Yeah, 30 minutes. I feel that too. Are you okay?
Yeah.
You can on the floor. Say how.
Yeah, it actually feels better already. I can't believe that.
You can't believe, right? It's better already. Forward a little bit. Oh, much easier.
Much easier.
Side to side again.
I feel pop.
But it feels that way.
It popped a bit there, but that's,
Yeah?
yeah, much better. Oh my god, I couldn't even do that before.
Again.
Like so. I used to walk fast, trust me.
Yeah, try. Go ahead. Just working on this part now, not on this part
Yeah,
yet.
believe it or not, it's all the pain has gone away.
Yeah, it's come now, right?
Yeah.
Before it was
Before it was like a 10, now it's like a 1.
like 1.
Like my left hand is, it's my right hand's almost stronger than my left hand.
Wow.
Before I couldn't shake a hand.
Yeah,
That's great.
that's great, right? Your pain is much better now.
Immediate relief.
Okay, great. Thank you.
Thank you.
Since I started using my mini Zen acupuncture therapy, first of all, to assess patient movement, to check up the range of motion, and to find the pain is contraction pain or pulling pain. After that, palpate tendon nodules at the place of the muscle origin and ending, and also palpate high tension area, and also palpate the tendon nodules. After assessment, and I find the treatment target. They are high tension skin, the tendon nodules, the tendon scar and adhesive tissues, high tension muscle taut band, and swollen vein. When I perform the mini Zen acupuncture treatment, I only do up and down insertion, the needle, without leaving needle in the body. So each treatment I may just take around 5 to 10 minutes instead of before the 1 hour, because with this treatment I don't need the cupping, I don't need massage, so it saves my time. Next, I have questions for you guys. Do you want to increase patient volume in your clinic? If you say yes, I think this webinar is for you. If you say I don't care, so I think you can stop here, and I don't want to waste your time. Do you want to become the master of the pain treatment? If you say yes, yes, it is for you of this webinar. If you say I don't care, yeah, you can stop here and don't waste your time. Dare you use needle with a blade? If you answer say no, I dare not. I may ask you why. I assume your answer is, it is dangerous, it is not safe, it may damage that blood vessels and the nerves, right? Okay, I'll tell you my answer after a while. Dare you use knife in kitchen? I know your answer. Absolutely, yes. Why? I know your answer is because I know how to use it. I got trained from my parents since I was a kid. So I know how to use that. Yeah, here you answered the questions I had before. Dare you use the mini Zen needle to treat your patient? You said no, because you didn't get trained. So after you get training from my course, and then you will become very confident and comfortable to use this blade needle to treat your patient. So you will be worry-free. Next, can we use mini-zinc acupuncture in Canada or in States? I say yes. Why? Please don't forget, in ancient time, 1500 years ago, we already have 9 different kind of needles has been used in that practice, right? So, any needle, to my understanding, is legally to be used in the clinic as acupuncture therapist, just like dry needling. Here, I would like to say mini-zinc acupuncture is the best choice for the treatment of soft tissue injury pain and is an essential skill for acupuncture therapists. Why? Because it is very safe. No pain or just mild pain. It is very efficient in the treatment. No side effects, and also no special needs, no special aids. We just need basic space, and also it is very simple and easy to learn. Next, let me talk about the cause of soft tissue pain disease. I'll say more pain caused by scar adhesive tissues and myofascial trigger points. First of all, let me talk about scar adhesion. From these pictures, we can tell muscle injury tissue progression. Before the injuries, it is at the healthy tissue, the muscle fibers, the blood vessels, the nerves organize properly. But when the soft tissue or muscle injured, we can tell the fibers has been broken, the scar tissues formed, and also some swollen edema, inflammation inside. So we call this tissue is strand tissue. After healed, lots of scar tissues formed inside of the muscle. So we call this scar tissue. When scar tissue formed, what happened? First of all, it will increase the risk of the re-injury. Second, it will cause the decrease of range of motion. So here, scar tissue forms to heal injured tissue, leaving the muscle weaker and less flexible. How many types of scar adhesion tissue? It has bone and flesh adhesion, muscle and ligament adhesion, muscle and muscle adhesion, muscle and nerve and blood vessel adhesion, blood vessel and ligament and nerve adhesion, bone and ligament, nerve and blood vessel adhesion, intermuscular membrane contracture scarring, tendon adhesion between membranes, and nodules and scars in between. These are the main pathological factors of this type of screening. Here I just give you example. Use that the balloon and the tap represent the normal muscle and the scar tissue. Once that the balloon is L form inside, and then the shape looks very beautiful. But when the tap around the balloon shape will change, and then the tension is different from above and the lower part. And also the tap direction has big impact on the balloon. That means the scar tissues, if you have different kind of directions, it will cause different kind of impact on the muscles or other soft tissue functions. Here, the chart talks about the soft tissue secondary injury from scar adhesion formation.
Scar adhesion tissue negative impacts. Scar tissue is the body's self-healing outcome after soft tissue injury. Scar is fibrous connective tissue, with high toughness and poor elasticity, which makes it difficult for the body to digest and absorb. When adhesion occurs at a certain point or part of these soft tissues, muscles and other soft tissues cannot stretch and slide freely in the body, causing imbalance in the body's dynamic movement, leading to physical dysfunction and secondary inflammation. At the same time, the adhesion is pulling and squeezing the nerves, causing pain, tingles and numbness, swelling and soreness.
Here is a picture to show the fascia, blood vessel, and nerve are compressed by scar tissues. Second cause of chronic pain is myofascial trigger point. A myofascial trigger point is a hyper-irritable spot, usually within a taut band of skeletal muscle, which is painful on compression and can give rise to characteristic referred pain, motor dysfunction, and autonomic phenomena. These pictures show the trigger point complexes. From here, it has taut band and trigger point. So when muscle fibers shorten, they form a taut band. And contract the muscle fibers decrease blood supply, causing nerve irritation and pain. Myofascial trigger points. It has 4 different kind types. One is active trigger point. It is on muscle taut band. It is painful nodules, plus tenderness. It can cause referral pain, radiation pain. Second is latent trigger point. It's on muscle taut band. No pain, but very tenderness. From location, it has central trigger point. The painful nodules in the tension zone of the muscle, the body. Another one is called affiliated trigger point. The painful nodules in the tendon, muscle start and end points. Characteristics of the active trigger point. It has pain and tenderness, swelling nodule, high tension, low pH, high acidity, high concentration of inflammatory pain substances, the blood microcirculatory disorder. This chart shows the changes in the pH, neurotransmitters, kinins, from TNF, IL-6, pH, substance P, and all these kind of chemicals in active trigger points much higher than that in the latent trigger point. So questions here. What is the best method to treat the pain caused by scar adhesion and trigger points? As a massage therapist or physiotherapist, even chiropractors, they always suggest the patient to use rubber ball to smash the trigger point. It works, but it is very hard work. And also, it is very low efficiency because when you put a rubber ball behind the back, for example, maybe you have to work around 5, 10, 20, 30 minutes each time. And every day you have to work around maybe 2 or 3 or 4 times a day. So it is quite time consuming. Right now, very popular in the physiotherapist they use dry needling. It worked, but it is painful. And also, it can't break up scar tissues because it doesn't have any the blade on top of the needle.
The Ren needle is a powerful weapon to treat scar adhesion pain. Moreover, due to scarring and adhesion, the circulation are often blocked, leading to local muscle atrophy and swelling. If there is a large area of scarring and adhesion, it will also cause certain muscles and ligaments to squeeze and thicken, shorten, harden, and reduce elasticity, resulting in abnormal human appearance. Generally, acupuncture needle, dry needle can only penetrate the scar connective tissue, but cannot cut off. Only a blade needle of mini-Ren acupuncture can cut off the scar and connective tissue, relieve its pressure and friction on other soft tissues, eliminate pain and numbness, and improve blood circulation, to promote healing process.
Here I have two fire guns, for example, as a normal muscle, and also two rubber bands as an example of the skin and soft tissue. Normally, the muscle is supposed to work very smoothly between each other. But in case that some injury happened between these two muscles, and then the scar tissue could form. So here I just use that strain, for example, as a scar tissue between these two muscles, because the scar tissues, it doesn't have any elasticities, so that muscle's movement should be interrupted. And in the clinic, as a regular acupuncture therapist, when we use regular acupuncture needles, it can penetrate the scar tissues, but you can't to break up. Here, if I use the mini-Zen acupuncture needle with a blade on the top of the needle, and then the blade can directly break up the fibers of the scar tissues. And then with this treatment, it is very easy to break up the scar fibers and then release the tension between the muscles, and not the muscle, the function back to normal. So that's different from a mini-Zen acupuncture and the regular acupuncture treatment.
The mini-Ren needle is the best weapon to break up myofascial trigger points. Myofascial trigger point, MTRP, is a painful or tender nodule. It can increase the tension inside nodule and outside tissue. It has tons of pain chemical substances stimulating nerve endings to cause tender and pain. It has poor microcirculation inside of nodule, which causes tissue necrosis.
MRA blade needle is more effective to release abnormal tension of MTRP's nodule and wash out the chemical pain substances. MRA blade needle can improve microcirculation around MTRPs to promote healing process. MRA blade needle can directly cut off the connective tissues of scar and MTRPs, which compress the surrounding soft tissues, blood vessels and nerve fibers, very effectively release pain, tenderness and tingles numbness. MRA needle stimulating action can help loosen up muscle cramps, release muscle stiffness and pain.
Let me talk about the details of the features of mini-Zen therapy.
The needle tip is very tiny, only 0.35 to 0.50 mm by 25 mm. The treatment is very safe, the insertion depth is less than 1 cm. The treatment process is short, easy and pleasant. Each session of treatment needs only 2 to 10 minutes. 4. Treatment frequency is once every 3 days. 5. The general course of treatment is 1 to 3 sessions. 6. The treatment method is simple with only the up and down insertion. 7. This therapy supplies accurate assessment and diagnosis by the patient's movement disturbance. 8. The treatment targets include scar tissues on the deep and shallow fascia, tendons, muscle origin or insertion sites, trigger points on taut muscle band, cutaneous nerve compression sites. 9. The treatment effect is immediate. The long-term outcomes are even better. 10. Diagnoses and treatments are objective and accurate.
I mean that your pain still here, right?
Yes, so this one. This one.
Is that here, right?
Yeah.
Yeah, so, okay.
Yeah.
Yes, here, right? Yes. Okay, you can just try that again to see how's the pain now. Do it. How do you feel now? It's better?
Better, yes.
Yes?
Yes, it's really.
Yeah, really different, right? Right away.
You see?
Yeah, see? Are you happy for that? Okay,
Yeah.
good. Okay, so we're done today. You can? Yeah, just show me where's pain. Yeah. Okay. This one, right?
Yes.
Yes. Okay. That just a second, okay?
Uh-huh.
Yeah. Good. Now, try again. To the back. Try again. Still there?
No,
Pain's gone, right?
looks like, let me try on the chair.
Sure, you can try the chair.
Yeah.
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 Pain's gone.
Mm-hmm.
See? 2 seconds.
Yeah.
Are you happy for that?
So much.
Yeah.
Yeah.
Okay, we're done. Today we want to treatment on neck, right?
Yes,
So typically this side, right?
right.
When you move arms up, what happened?
Tight right here.
Tied it right here.
Yeah, and then when I go further up, then it spreads down up.
Okay, move. And then turn the feel pain here.
Yes, right into there.
Right here, right?
Yes.
Okay, so your right side arms, left shoulder. Right, good. And then again.
Oh, yeah.
Good.
Yeah.
Right?
Yes. Oh, definitely.
Yeah, a lot of scar tissues here, man.
Yes, right there.
Here, right?
Yes.
Yes.
Okay.
On the treat after, okay?
Yes.
Mhm.
Yes. Oh, that feels softer already.
Yeah. Yeah, right?
Yep. Wow, that's gone.
That's gone.
Oh, wow, that's gone too. Oh, much. Well, coming down is a little tough.
Wait, back. Hands up again. Slowly back. Slowly down, down, down.
Whoa.
Which part here?
Yeah, right in there, because I can feel it running down.
Yeah?
Yeah, right there.
Yeah, right?
Yeah.
Okay, go back. Right there. Try again. upper back.
Wow, amazing.
Can I help you today, man?
Oh, I got some tingling sensation in my side of the head and above the ear and the hairline. So
When did it happen?
falling asleep the first and second week in June.
In June.
Yeah.
Okay, so that is almost 1 month
Over a
now.
month. But I had come down with COVID, so I couldn't come in.
Yes,
And then we had a wedding and we had company from BC, so
yes.
it's been busy.
So right now that happens very frequently, or just once in a while?
Every day I get it.
When winter turns side?
Yeah, if I'm sitting here for a while like this and I hold it down,
Yeah.
then it starts to tingle.
Where's tingle exactly tingles?
It'll tingle through here,
Okay.
up in the hairline. It feels like something's crawling under the skin.
From skin, yeah?
Yeah, like right in here right now I can feel it.
Okay.
It feels like a mosquito is bitten, it's itchy and you always want to scratch it, but I know I
Okay.
shouldn't. And
Okay.
right there it's tender.
Good tender here, right?
Yeah.
Yes, good. Oh yeah?
Yeah.
Tender too, right? Oh yeah?
That's not too much
Okay,
there.
good. Yeah, and continue to this way. Okay. Tender here?
No.
No? No, eh?
No.
No, okay, good. So I believe that he's suffering from what we call nasal occipital nerve improvement because right? To the right?
Yeah, I can hear that in the head. I don't feel anything yet.
You don't feel anything yet, right? So that's great. So usually how long when you hold this position you will stop your
Sometimes it takes not even 30 seconds.
seconds, that's seconds, eh?
Like sometimes if I'm doing something in the kitchen,
Yeah.
making something to eat or something like that, and I got my head down, I heard it start and I can feel it.
Okay, but so far you don't
So
feel
far I
any-
don't feel it, but
Yeah, magic. Yeah, I said magic.
Very nice. Magic.
Have a neck pain since Monday?
Yes, since Monday I got in a fight with an inmate, and just after that, I woke up during the night to feed my baby, and yeah, my neck was really hurting, and then it's been a steady pain since then.
Yes, so that can you just turn head side to side?
Okay.
Where's do you have pain?
Yeah,
Where it is?
on the left side of my neck.
Okay, how about to the right side?
It's worse on the left side of my neck.
Still here?
Yeah.
Okay. Okay. Can you just bend down? Head down. And then do you have?
Minor.
Minor. Still here?
Yeah.
How about the backwards?
That sharp pain, that's probably the worst.
Where it is?
Still the left side. That's when it is going down. I can feel it in my trap.
Okay, from here, right?
Yeah.
All from here, right?
Yeah.
Okay, relax. Okay. Side, side. It's good. Other side.
Mhm.
It's better, right?
Yeah, I don't feel in my neck anymore, just in the shoulder.
Just the right shoulder now, right?
Yeah.
Like it's better now, right?
Yeah.
Yeah.
Yeah, it's better.
It's better now, right?
Mhm.
So, we're done today.
Yeah.
Okay.
Okay, that hurts.
Yeah, that's hard, right?
Yes, yes.
Yes. But your elbow pain that the wink is this way, how long has it been?
Oh yeah, that's the worst.
3 months?
Like right there, at least 3 months,
So
yeah.
then 3 months, okay. See? That the pec minor also have the issues too. That's why some
Yeah.
people have chest pain. Okay. And then have biceps pain. Okay.
Mm-hmm,
Yeah, right.
mm-hmm. Hmm. In the middle, like right there, yeah.
Here, right?
Like so when I'm trying to pull up like this,
Yes.
that's where the pain happens.
Yes. Yeah, right. try starting to bend your elbows again slowly. When you feel pain, just stop there. Where's pain?
No pain.
No pain. Are you kidding me?
No pain.
Try again.
Yeah, no pain.
Yeah?
Okay, that's absolutely crazy.
No pain.
No pain.
Okay. So where's your pain?
There's no pain.
Okay, we're done today.
Really?
Yeah? Your pain's gone.
Yeah, there's no pain.
Okay, so let me talk about that the medicine acupuncture training classes in 2019 and 2020. This is training classes in my clinic in Winnipeg in 2019. I have 3 training classes at a time. The students come from Vancouver, Calgary, Edmonton, Toronto, and Los Angeles. They are so happy after the training, and they use these techniques very good in their practice and always achieve the best result they never expected. And also, I had training classes during the conferences in Vancouver, Canada, Toronto, Canada, and San Francisco. In 2020, I also had physiotherapy training classes in Winnipeg. 13 physiotherapists in my training classes, and after they learned, they use it very frequent, and they are very happy too. Here are some testimonies for those kind of the physiotherapists. They share their success cases by using medicine acupuncture treatment.
Testimonials from trainees. I have 2 interesting ones to share. The first is a young man presented with metatarsalgia and neuralgia that he had for many months. He had been for other physio, podiatry, etc. I used MRA along with joint mobilization and neural mobilization techniques, and his symptoms completely resolved.
The second is another young man who presented with cauda equina-like symptoms. He had been thoroughly invested for sinister causes and everything was found to be negative, at which point we could be confident it was simply a pudendal neuralgia. With MRA, we have resolved his symptoms almost 100%. At his last APPT he self-reported as 97% resolved. Thanks Dr. Huang's MRA.
The mini-REN acupuncture has been very helpful. I recently treated a 82-year-old woman with chronic lumbar spine pain, groin and lateral hip pain, all resolved with 3 sessions. The lumbar spine pain was gone with 1 session. She is already knew her stretches and strengthening exercises.
I did a tight gastroc and improved ROM as well as foot pain. I also did a greater trochanter for a glut that was sore on resistance and pain went away. So cool. Thanks again Dr. Huang.
Okay, next I would like to introduce my online medicine training course. Okay, here is the course content. We have chapter 1, 2, 3, 4, 5, 6, total 6 chapters. And chapter 1 introduces of medicine because blade, acupuncture, because superficial needling to break up the nodules. It has 3 lessons. Each lesson has 30 minutes, 50 minutes, and 40 minutes. Chapter 2, we talk about the treatment of the head, face, and neck disease with medicine acupuncture needle. It has 4 lessons too, and each one around 30 minutes. So lesson 1, 28 minutes. Lesson 2, 33 minutes. Lesson 3, 24 minutes. Lesson 4, 35 minutes. And then chapter 3, we talk about treatment of the shoulder, elbow, wrist disease by medicine acupuncture. It has 5 lessons. each one around 30 minutes, 31 minutes, 31 minutes, 30 minutes, 29 minutes, 33 minutes. And then we have chapter 4, the treatment of lumbar and back disease by using acupuncture therapy. It has 3 lessons, each one around 33 minutes. And then we have chapter 5, treatment of the hip, thigh, and the knee disease by using acupuncture therapy. So it also has 2 lessons, each one 30 minutes. And chapter 6, we talk about the treatment of neck, foot, and ankle disease by using acupuncture therapy. It has 2 lessons, one that is 34 minutes, one that is 20 minutes. So after training, you will understand that what is using acupuncture therapy and how to make assessment, how to perform treatment, and then you will see the big benefits. If you register this online using acupuncture course, you will get huge discount and bonus. So don't miss it. Right now we have regular prices is 1,500 Canadian dollars for the course. If you register right now, you can get only 998 Canadian dollars. You save $500 right away. Also, once you enroll this course, and also we'll supply free Zoom meeting tutorial once every 2 or 3 weeks, free to attend medicine seminar and receive updated teaching videos. And also you are invited to attend medicine related international conferences. Okay, I believe you have last questions is where to buy medicine acupuncture needle. Here is at the website, and also you can order medicine acupuncture needle online. Here is that the needles we call flat head needle has been approved by the Health Canada. The brand name is called Zagu, is a market brand name. Minizenzhen is our Chinese name. And Anka Acupuncture Clinic is the only medicine acupuncture needle distributor in Canada. Here is that the medicine acupuncture needle. How does it look like? This is small, the box, just 1 twin, the size of the acupuncture needle size. This one looks exactly the same size as 1 twin acupuncture needle. And here is the label. Here also, you can join us WhatsApp medicine study group. You can add 431-588-4888 in WhatsApp, or using WhatsApp camera to scan the code to join. Thanks very much. If you have any questions, please let me know. Here, I want to emphasize again, if you buy the course today, you get a $500 discount right away. Don't miss it. Learn it earlier, you will become the pain master earlier, and you will get more benefit earlier. Have a great day. Good luck.